going to have my line here, and then I'm going to expose this, give it a tug, and now I need to keep this port clean. I don't need to alcohol wipe it or anything, but I'm going to keep this port clean. And then with my other hand, I'm going to pull this off, okay? Again, I'm going to keep this clean, and then I'm going to marry the two. I'm going to marry the two. Okay, and it's just a twisting back and forth. Okay. And then what I'm going to do is before I flip it over, I'm going to kink this here. All right? I'm just going to keep this drip chamber, and I'm going to turn this around, and I'm going to hang this up. Okay? So now I'm ready to prime, and what I need to do is I'm going to fill my drip chamber halfway. So sometimes it takes 2 squeezes. Okay? If I don't do this, I'm going to enter air. Okay? And it's okay if you get air, it's just that you're going to have to bleed it through. You're going to have to bleed it out if you do get air into it. So it's not the end of the world. You know, people are really nervous about air in the line. You should not, as a good nurse doesn't have air in her line. If she does, she clears it, or he clears it, okay? But it takes, this is 20 mLs, it takes more, it takes more than a whole line of air to actually cause a problem. You hear about people getting air emboluses and being really concerned, so just to keep that in mind, okay? So now I have my drip chamber full. You can see there's a little bit of air, but that's okay because it's going to bleed right through. I do not need to take this off, okay? It can prime without it. And then I'm going to let gravity do its work. And I should have put a little food coloring in here, but then you're going to see it's just going to drip right through. And now I have primed my line. And the last thing I want to do is I want to make sure that everything is full. It's hard to tell, so I always watch the flow all the way down until it's nice and free-flowing. So now I'm ready to go ahead and connect this to my patient, okay? This tubing is good for how long? Huh? 24 hours. So believe it or not, if it's intermittent, if I'm just going to give it to my patient and then disconnect and get, fluids, it's only good for 24 hours. But if my patient was in the hospital for like 3 days, say, it's good for 72 hours, okay, if it's continuous. And that whole principle, you guys, if you have things flowing and moving along, bacteria doesn't like, bacteria loves stagnation. The flow keeps it moving along from preventing anything from growing. Okay, all right. Tomorrow, or Thursday, I'm going to talk about labeling, how we would label this. But for now, I want to move towards how we would calculate a drip. So I want you to grab that piece of paper.